Good morning. Today is Tuesday, March the 18th. I'm calling the TennCare Subcommittee to order. Madam Clerk, will you open the board for us to take roll, please? Members, if you'll log in, make sure you... All right, everybody's logged in. Madam Clerk? Oh, I'm sorry. Representative Love? Now we are.
Mr. Chairman, you have 5 members present. You have a quorum.
All right. Thank you, Madam Clerk. At this time, I'm going to ask Representative Love if he would lead us in a word of prayer and then in the pledge.
Thank you, Mr. Chairman. Let us pray. God, we thank you for last night's lying down, this morning's rising up. We thank you, Lord, for a chance to gather once again to do the business of this committee. We thank you, God, for traveling grace and for watching over us and allowing us, God, to deliberate and to hear each other's bills and also, God, to do the work of your people. Bless us, oh God, is our prayer. In your Son, Jesus the Christ's name. Amen.
Amen.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I know it was tough for some of you to come in this morning after being out there playing with the animals and Ag Day. So, but we'll just stay inside. I would love to have got to move us outside. We're going to have those discussions. So, before we get started, item number 4, House Bill 455, has been taken off notice without objection. So that brings us to our first item, which is House Bill 728 by Chairman Hicks. Have a motion and a second. Do you have any amendments, sir?
I think there's no amendments to this.
All right. Well, you are recognized on your bill.
Oh, hold on a second. Let me make sure there's not before we carry on here.
I don't see any.
Okay. Okay. Thank you, Mr. Chairman, committee. Thank you all for your indulgence. 728, House Bill 728. And this is simply, this bill renews the annual nursing home bed assessment, and that will be through June 30th, 2026.
All right. So, does any member, Chairman Sapiki, you are recognized, sir.
Question on the bill.
Question has been called. So, Madam Clerk, if you would open the board. If all members would vote. Has everyone voted? Anyone want to change their vote? All right, Madam Clerk, you take the vote.
Mr. Chairman, you have 4 ayes and 0 nays.
All right. House Bill 728 moves on to insurance full. Thank you, Chairman.
Thank you, Chairman and committee.
Now we're ready for number 2. I think that would be Chairman Hicks, also House Bill 829. Motion and second. I believe you do have an amendment on this one, correct?
I do, Chairman. That's where I got a little confused on the first one. So that is correct. I have 4503.
That's what we have. Motion on the amendment. Second. Any objections to adding amendment 4503 to House Bill 829? Seeing none, amendment 4503 is adopted. I guess we need to take a vote on that, right? All in favor of adding the amendment, aye. Any opposed? All right. So the amendment is adopted. Chairman Hicks, you're recognized on your amended bill, sir.
All right, Chairman Hill, thank you. And members, this is just the annual hospital assessment that we run every year. The bill continues the hospital coverage assessment passed each year to fund a major part of the TennCare program.
All right. Any discussion? Chairman Speaky.
Question on the bill.
Question has been called. So members, we're ready to vote. Madam Clerk, would you open the board? All members vote. Any member wish to change their vote? Madam Clerk, would you give us the vote, please?
Mr. Chairman, you have 4 ayes and 0 nays.
All right. Chairman, House Bill 829 moves on to full insurance.
Thank you, Chairman and committee.
All of those, 10 and 11. Okay, I got it. I'll just do it then. Okay. All right, we're now ready for item number 3, House Bill 173 by Chairman Martin. We have a motion and second. Sir, do you have an amendment with this one?
No, sir, I do not.
All right. Well, you are recognized on your bill, my friend.
Thank you, Chairman and committee. This here is the Save Rural Hospital Act. So what we're looking at doing, Tennessee's second in the country currently in rural hospital closures. So we're wanting to help get reimbursement rates up to par. Currently, 2006 was the last time these rates had been adjusted. We're just trying to get the aspect of the rural hospital rates to the break-even point established by the USDA, U.S. Department of Health and Human Services. With that, we hope to help save some more of the rural hospitals in Tennessee. I stand ready for question.
Members, you've heard a discussion of the bill. Chairman Speaker, you're recognized. Question has been called. All right, members. Madam Clerk, if you will open the board. Everyone voted. Anyone wish to change their vote? Madam Clerk, will you give us the vote, please?
Mr. Chairman, you have 4 ayes and 0 nays.
All right. Chairman, your bill's moving on. House Bill 173 moves on to full insurance.
Thank you, Chairman and committee.
Next, we're on item number 5, House Bill 782 by Representative Martin. Have a motion and second? All right. You've got a proper motion and second. I don't see any amendments on this. Representative Martin, you are recognized on your bill, sir.
Thank you, Chairman and committee. The PACE stands for the Program for All-Inclusive Care for the Elderly, and a PACE program allows frail older adults to safely remain living in their community. PACE provides all services at one location and allows those being served to continue to live in their homes. PACE programs are fully capitated, and the program is responsible for all cost of health care and long-term supportive services for frail older adults who are eligible for nursing facility level of care. PACE is a unique program that is enjoying significant growth across the country, and Tennessee currently supports one PACE program in Chattanooga. The program is very successful, but it is statutorily restricted to only a certain number of enrollees. And this legislation requires the TennCare Bureau to authorize one additional program in either West or Middle Tennessee. This legislation also expands the current Chattanooga program to allow participants that hail from counties in Tennessee surrounding Hamilton County. The PACE program are very popular with family caregivers. They reduce hospital readmission rates significantly, and they improve the quality of life for both the person receiving the services and the caregiver. Tennessee seniors outside Hamilton County area deserve the opportunity to have this as an option for care. And with that, Mr. Chairman, I'm happy to answer any questions, and I thank you for this opportunity.
All right. Thank you, Representative. Do we have any discussion? Chairman Speaker, you're recognized, sir.
Question on the bill.
Question has been called. All right. Madam Clerk, would you open the board, please? All members voted. Anyone wish to change their vote? Madam Clerk, would you give us the vote, please?
Mr. Chairman, you have 4 ayes and 0 nays.
All right. Representative, your bill, House Bill 782, moves on to insurance full.
Thank you, Chairman and committee.
All right. Now we're ready for item number 6, House Bill 372 by Chairman Halsey. We We have a motion and second. Do you have any amendments, sir?
No, sir, I do not.
All right, we like that. So you're recognized for your bill.
Thank you, Chairman. Thank you, committee. This bill is called the Tennessee Modernization and Access Act of 2025. I got to change the name so I can say it, but it's a great bill. I'm sure you're aware of the fact that doctors who treat TennCare patients, and by the way, this bill does not increase the roles of TennCare at all. But you are aware that the pay for small doctors groups, independent doctors who treat Medicaid patients, TennCare patients, get paid most of the time half of what Medicare payments are. And what's happening is we're losing doctors. I don't mean moving. I mean they are ceasing to treat and take Medicaid patients. The ones who still do are limiting how many they will take because they're losing money with every patient. Now, CMS gave a waiver to hospitals, or government did not too long ago, and gave them a commercial rate. But that's only half of the formula. The other half is all the doctors that don't work for hospitals and are in private groups who are, particularly in rural areas, who are at the place now where they say, I'm not doing it anymore. I'm losing money. I can't even pay my overhead. So whether we address this with my bill or some other bill, we got to address it. And it's got a huge fiscal note on it, $600 million. My hope is to get it out of committee and get it behind the budget and finance and be able to really look at this bill. But I have somebody here who would like to speak on this, who's a doctor in my neck of the woods and drove all the way down. Her name is Dr. Higginbotham. And if you would allow her to address you, I would appreciate it.
All right, without any objection, we'll go out of session and we will hear from Dr. Higginbotham. If you'll come up and we'll control your mic, we'll turn it on and you'll have 3 minutes. And we just ask that for the record that you please identify yourself, who you're with, and then we'll start the clock.
Okay. Thank you for providing me the opportunity to share my perspective. My name is Dr. Leah Higginbotham. I'm a board certified pediatrician with Riverside Pediatrics, which is within State of Franklin Healthcare Associates. My practice, Riverside Pediatrics, is located in Elizabethton, which is the county seat of Carter County. Riverside Healthcare Associates is an independent physician group in Northeast Tennessee and Southwest Virginia. We have 35 practices located in 10 communities, serving 18 counties. My practice not only cares for people in Carter County, but I also draw patients from Johnson County, Unicoi County, Sullivan County, Washington County, and even Greene County. In 2024, State of Franklin Healthcare Associates provided care for 18,000 patients who have TennCare as their primary insurance. My practice cares for over 3,200 pediatric patients, which over 56% or 1,900 are insured through TennCare. I feel this bill is essential to reverse pretty much a dire situation that I've seen for TennCare patients in regards to medical access. There's been a significant contraction, especially in the last 5 years. I have a few examples. Healthcare providers who were willing and able to diagnose patients for autism spectrum disorder have kind of left our area. It used to be about an hour drive for my patients to get an evaluation. Now it's about 3 hours with Siskin and Chattanooga. None of my patients can get dental service anymore in the area within about a 100-mile radius. And usually when specialists start declining, that's more of a harbinger of things to come. And these aren't just anecdotes. The state's own Department of Health packages, county packages have shown that pediatric care in Carter County has decreased fivefold within a year from 2023 to 2024. Johnson County has no pediatric providers at all. It's not uncommon for patients to drive over an hour to see me in my practice. The loss of access has important ramifications for the communities and taxpayers, as you know. Without access to primary care, obstetrics, gynecology, and mental health, patients are forced to utilize higher cost access points like hospital ERs. They're more likely to avoid care due to the burden of travel. They're more likely to increase the likelihood of higher medical expenses for the state. Lack of prenatal care increases infant mortality. Mental health lack, of course, increases risk of homelessness, poverty, unemployment, family breakdown, crime, and loss of economy. When I first started practicing medicine, I'd never imagined myself being in a rural practice. I did practice 2 years in Nashville before joining Riverside Pediatrics in Elizabethton. But honestly, I can't imagine practicing anywhere else. There's a deep sense of community. Families are really rooted there. My time up?
Your time is up,
Oh,
Dr. Higginbotham.
bummer.
So if
Okay.
you want to wrap up that
Okay.
comment right quick.
Just basically, it's very sad to see the loss of practice. And we have always been open for TennCare patients fully. That's who we care for. That's who is in our community. But it has gotten to the point that we can't do that anymore. And I worry that even my practice will be able to be sustained, as I wouldn't be able to bring anybody in because I can't guarantee that they would get paid for their work.
Okay. All right. Thank you so much.
You're
I think
welcome.
we've got some questions for you now, maybe. Chairman Sapiki?
Doctor, would you like to finish your last thought there so I can?
Go ahead.
That's basically it. I mean, I'm worried my practice won't be able to sustain itself in its current form, which I think would be a huge loss to my community because I do feel like my workers are from the community. We know our patients, we cry with them, we share in their joys and their successes, and not having that in the community would break my heart.
Chairman Sapiki?
Good, thank you.
Good. Representative Sparks?
Are you from that area?
No, I'm not actually.
Yeah, I didn't pick up an accent.
Yeah, I mean, I can tell you where I'm from if you want,
Yeah.
but I was born and raised in Minnesota, went to college and med school in Texas, did residency in Alabama, in Birmingham, which then brought me to Nashville. But I've been 15 years now.
I was just curious what drew you to that community?
Yeah, like I said, I didn't ever think I would be in that community. Mostly Nashville wasn't kind of a right fit, and I still enjoyed being in Tennessee and found this practice. And it was initially just me and two other women. I'm still with one of the other providers. Like I said, we've been together now for 15 years. And it was an adjustment, but it's nothing like any sort of environment that I've ever been in. Like I said, the sense of community is something that you just don't necessarily get in a big city.
Yeah. Well, you mentioned Harbinger. What other indicators do you look at?
Well, specialty care, I just feel like is one of the things. You have more opportunities to not take TennCare patients because you have a much broader base that you're drawing from. So when they start decreasing their use, then usually that means that the cost to care for them are not worth their time. And, there's things we can do in primary care because we do have, larger bases or things that we can draw from. We can have smaller overhead, which we've done in our practice. We have low rent, us as doctors pull up our sleeves and run lab tests ourselves when we need to, just so we can be able to keep costs as low as possible, knowing that we don't have higher reimbursements. And so that's what, if this doesn't change, I just don't see, if our practice, which has never had the desire to really limit TennCare or never felt like we had to, has to start doing it, then I know I'm not alone in that scenario.
Yes, ma'am. Thank you.
Yeah.
Let me ask you a question, and then Representative Love. So can you kind of tell us, I've had conversations with hospitals and stuff, like their percentage of commercial pay versus Medicaid, TennCare, whatever. Can you kind of tell us roughly what you would think that your percentage of patients?
Oh, yeah. So I'm at 50. Our highest amount of patients we have in our practice is through TennCare. So we're at 56%. And then the rest varies, through the commercial. We have about a 3% self-pay rate, within the rest being commercial insurance.
Okay. All right. Thank you.
Yeah.
Representative Love, you're recognized.
Thank you, Mr. Chairman, and let me just commend you for your work. We have tried to initiate programs over and over again to get more doctors and healthcare professionals into our underserved areas. And what you're talking about is primarily one of the things that blocks it, is the reimbursement rate. So thank you for that. Thank the sponsor for bringing this bill.
Yeah. Thank you.
All right. While we're out of session, any other questions for Dr. Higginbottom? All right. If not, thank you so much for being here today, and
Thank you very much.
we appreciate you. All right, members, we are back in session, and now
Thank you, Doc.
we'll recognize Chairman Halsey for any other comments. And
Thank you, Mr. Chairman. In this bill, there is a funding formula that will pay for it next year. It sets a rate for the MCOs, and it designs a way to be able to be funded next year. It's this first year that's the big one. Like I said, it's got a $600 million bite on it, and shouldn't be something we can't do though. Since TennCare is turning back in $660 million this year, so it's a common sense way for me to look at it, but it's never that simple. But at the end of the day, we have to fix it because we're losing people. We are losing doctors who will not treat Medicaid people because they're going under. They're losing money. We can't keep down this path. We got to fix it. So anyway, I'm open to your questions.
okay. Representative Starks, you're
You
recognized.
mentioned, one thing I don't like about being on this committee, not to say I don't like being on this committee, but boy, I see a lot of hefty fiscal notes on here, and as a fiscal conservative, I get a little concerned, but $604 million, what's the other option if this doesn't happen?
Well, if we keep going down this path, the end of the results is going to cost you more money, because if you have people who they can't find access to primary care, then they don't deal with medical issues that become chronic. So then their only result is to go to emergency room. So when you go to emergency room and now you've got a chronic deal for a diabetic, then you end up in surgery and cutting off a limb, and the cost for that and the hospital stay and what's following that all gets paid at a much higher rate, at a commercial rate at the hospital. So you're going to lose money. You're going to spend more money going down the road if you don't fix it.
Yeah.
But these things need to be addressed. I don't know if you know this or not. You probably do. I didn't know it. But the 3 MCO providers in the state of Tennessee, it doesn't matter if all the enrollees in TennCare go to a primary doctor or only 60% go. The MCO still gets paid for the other 40% that don't go. So that's another thing we need to fix. That's addressed in this bill. But if you don't fix it, it's going to cost you more money down the road, because the only alternative for these folks is to go to emergency room.
Chairman, I don't know if any of y'all watched the Department of Health presentation last week, but it was a graph that showed how Tennessee rated. Did y'all see that?
Mm-hmm.
It was embarrassing. We did rate good in volunteerism, Clint. We were 27th, but we were like 47, 49, 48, maybe 50 in certain areas, and just alarming. I don't like to be in last place, Well,
to that point, Tennessee is the only state in 50 in 50 states that does not have a Medicaid fee schedule. We are the only one.
Yes, sir. Thank you, sir.
So let me ask you this, Chairman Halsey, on the physical, kind of going back off of what Representative Sparks said there, and you've made the comment of the $604 million state, and then of course a little over $1 million federal. But then you said it would pay for itself or the expense the following year. So can you explain to us if it's a 604, then what's going to offset that? And
Yes, sir. There is a fee schedule where the MCOs can only take 1 to 2% of this bundle of money for administrative costs. The rest of it goes to providers. 80% goes to providers, and a 20 other percent goes to the program that providers have for exceptional care, kind of a reward system for doing it better or doing it more. But it does limit what the MCO could take.
so do you know what that physical is, like year 2 and going? I mean, is there?
No, I
Any
am
discussion?
told though it will pay for itself. And I'm sorry, I don't.
Okay,
I don't
okay. Well,
have the
I just seen in this, it said FY 25, 26 and subsequent years, it left that same dollar amount. So I just wasn't sure.
Well, with the pay schedule, that's supposed to be a wash. With limiting what MCOs can take.
Okay.
It should break even.
Okay. Any other questions? All right. Seeing no other questions, I guess we are ready to vote on House Bill 372. So, Madam Clerk, would you open the board, please? All right. Has every member voted? Any member wish to change their vote? Madam Clerk, will you take the vote, please?
Mr. Chairman, you have 5 ayes and 0 nays.
All right, Chairman. House Bill 372 moves on to full insurance.
Thank you, Mr. Chairman. Thank you, committee.
Thank you, and also to Dr. Higginbottom for her comments today. Now we move on to item number 7, which is House Bill 1158 by Representative Lynn. Representative Lynn, you have a motion and second. Do you have any amendments, ma'am?
I do not think so.
All right, no
No,
amendments.
I do not. No,
All
I
right.
do not. That's nice.
Well, ma'am, you are recognized to describe your bill.
Thank you, Mr. Chairman. House Bill 1158 would be, I guess, sort of an enhancement to the Katie Beckett program. The Katie Beckett, on this bill, I want to say, was brought to me by the Tennessee Disability Coalition on behalf of Tennessee families participating in the state's Katie Beckett program. The Katie Beckett program is a program that we passed into law, I think in 2019 in Tennessee, that helps the most medically fragile children of our state. It was actually created in 1982 by Ronald Reagan. However, Tennessee took all those many years to pass it, and it really was the great work of Representative Matthew Hill that we were able to pass this and fund this in Tennessee in that year. So we're very happy for that. But what it does is there are families who have health insurance, but their children have such extreme medical needs, health insurance doesn't fund everything. And Part A allows these families to buy into TennCare or our Medicaid program. The Katie Beckett program allows these children with profound disabilities or chronic health conditions to actually enroll in our Medicaid program to cover extensive costs of their care, regardless of the parents' income or assets. Previously, if their health insurance did not cover every medical need, these families often struggle terribly to pay for these needs for their children, and some parents even quit work so that they could just get on Medicaid, which didn't make a whole lot of sense. So this program allows them to get that help from Medicaid. Part A has about 300 slots a year for children in Tennessee. We can have 300 children in Part A. Currently, 239 children are on Part A. And there's about $15,000 in services allotted through Part A for home and community-based care. And what this does is it helps families keep their child at home instead of in an institution, which is very nice. But it also will help pay for those institutional cares needs as well. So what this bill asks is that TennCare take necessary steps to offer a health reimbursement account option for families enrolled in Katie Beckett Part A to utilize the program's home and community-based funds. As I said, there's about $15,000 allotted, but it's really a difficult program to go through for these families. So on average, these families get about $2,800 worth of services instead of that $15,000. And Mr. Chairman, I do have a gentleman here from the Tennessee Disability Coalition. If you would allow some testimony from him, I think he would be so much better to explain the difficulty that these parents go through and why this bill is needed, if you would grant that.
Okay. All right. Without objection, we'll go out of session, and we have Mr. Jeff Strahan on behalf of the Disability Coalition to testify. So, Mr. Strahan, if you'll tell us who you are, where you're from, and then also we'll begin the clock, and you'll have 3 minutes, sir.
Sounds good. Thank you. My name is Jeff Strahan. I'm the Director of Public Policy at the Tennessee Disability Coalition. Thank you, Chairman and Committee, for the opportunity to testify. So I just want to kind of describe Katie Beckett as it exists right now. Tennessee has a very unique program. Katie Beckett is broken up into Part A and Part B with a weird little Part C off to the side. Part A serves the 300 most profoundly disabled children in Tennessee, chronic health conditions. These are very difficult diseases and illnesses that they deal with. They tend to have short lifespans, and their families want to spend more time with them. Part B is for children who are potentially in need of nursing home care. So they don't quite have the same level of need as in Part A. So Part A is really who we're talking about here. And so we've been working with these Part A families for well over a year now, kind of taking stock of what 6 years of the Katie Beckett program looks like. And this is their number one issue with it, is that when passed, the General Assembly intended that folks were able to use these home and community-based services funds to fill in those gaps that Medicaid and their private insurance couldn't cover. These are things like formulas, durable medical equipment like a ventilator, oxygen tanks, things like that that are difficult to acquire. In Part B, they can utilize these funds through the health reimbursement account. It is still, to some extent, burdensome. There's a lot of documentation required, medical necessity, prior authorization, all those things that you typically associate with an insurance company. But in Part A, they have to go through their MCO. And that has proven to be so difficult that families are choosing to move back to Part B and forego their Medicaid access, or, as Representative Lynn said, only be able to use about 18% of the benefit, about $2,800 out of that $15,000. And that's not really the intent here. The intent was to fill in those gaps, to take something off the plate of these families so that they can spend time with their kids who are not going to live a very long time. Instead of spending time on the phone with their MCO, they tell us that they want to be at the park. They want to be doing puzzles, watching a movie with their kid. And we think that this is a very reasonable option. This is what they do in Part B. We'll just make Part A look a little bit more like Part B. I've heard concerns about the equitability of this. I think with the intention here, the General Assembly to put $15,000 in these funds available to them, I wouldn't find the ability to spend that to be inequitable. So I am happy to take any questions or thoughts or comments.
All right. Thank you so much. Anyone have any questions for, all right, Representative Love?
Thank you. Thank you, Mr. Chairman. You referenced equitability. What was the concern that some had about that? If you can help us understand.
Recognized.
I'd like to. I'm not sure I understand the concern about equitability. I guess those in Part A have two benefits: access to Medicaid and these home and community-based services funds to meet their medical need. They're only in Part A because of medical necessity. Part B doesn't have access to that Medicaid. It's a Medicaid diversion program. So they give them $10,000 to avoid being enrolled in Medicaid. So I would guess that if I'm trying to assign intent to that concern, it's that now these folks will have two easier to use benefits, whereas Part B only has one easy to use benefit.
Representative Love, any other questions? Go ahead,
Yes, sir.
sir.
Thank you.
Yes, sir.
You mentioned some parents or families opting to move from Part A to Part B. Is that to access more dollars, or is that to make the process easier?
It's to make the process easier. They believe that for the most part, they can cover those medical needs through their own private insurance and fill in the gaps with those $10,000 that are available to Part B families. But oftentimes they utilize those for like everyday items and purchases, diapers, formulas, things like that.
Okay. Thank you, Mr. Chairman. Thank you.
Okay. Anyone else? I want to say last week I had a young lady in the office that was honestly only given 3 years to live, and she's now 11. And they're wanting to take a trip this summer because they know they're on borrowed time and having issues with getting a portable oxygen concentrator to be able to take the trip and stuff. So I appreciate this and hope that we're moving in a direction to make things easier for these families and because it's ultimately about our people that we take care of them. So thank you. Anyone else have any questions for Mr. Strand? Representative Parkinson?
Thank you, Mr. Chairman. I don't have a question. I just wanted to thank you for, all of the hard work that you do in this area, man. I'm serious, man. I thank God for you because it's incredibly difficult to manage and navigate these waters when you're trying to care for somebody that you truly love, and unfortunately, in our state is gut-wrenching difficult to be able to provide that necessary care and comfort for that loved one, because of the bureaucracy in our state. But man, thank you so much for everything you do. I mean that too. I want you to know that publicly. Thank you.
Well, thank you. That's very kind.
All right. Thank you, Mr. Parkinson. Anyone else? Representative Sparks?
I just wanted to tell you thank you. Also, we've been talking about mental health and work-life balance. How do you, because I couldn't do what you do. I'll just be honest with you. I got 2 little grandbabies. I was holding them last night and I was thanking God that they're in good health, but work-life balance, how do you manage to do what you do? And then you've got the stress like that.
Mr. Strand, you're recognized.
Thanks. Well, I don't know if you all saw this last week. It was Disability Day on the Hill, and we had about 250, 300 folks with disabilities and their families come down here to advocate for the community. And that just always reminds me that this is a group of people for whom it's a privilege to work. And it's a community that's a privilege to work in, and it's a privilege to be able to do this job to try to help them. I never have to compromise because I know where I was doing the right thing. So thank you for the question. I don't know if that answered, but it really is the community.
Well, how do you decompress at the end of the day? What do you do?
I don't know how appropriate I can be here.
Don't say drink.
I spend time with my child.
Okay. Yeah. Well, everybody has to have something they do. I mean, I did ask this question to some caregivers a while back, and one of the ladies said, drink. I was like, oh, I didn't want to hear that. There's exercise, read. I was at a mental health conference the other day, and most people said read, exercise. They've got a pet, they've got family, their spiritual life. But I think it's a serious issue. We've seen suicide, sadly, a rise of suicide. It was a serious issue. And everybody has to have an outlet to kind of chill, if you will. So thank you, Jeff, for your work.
Thank you.
And off of that for last week, I think that's probably the most emotional day that I have all session and then of all the things we received through the year, a box of cards that I got that they brought in last week was probably the most appreciative thing that I've received. So thank you for the work that you do. So does anyone else have any questions while we're out of session? If not, thank you, Jeff, for your comments and for your work today. Representative Lynn, we are back in session and
Right.
you're recognized for any other comments.
Thank you. Thank you for your wonderful questions and your compassion and concern. And I just hope the committee will see fit to try to help these families.
All right.
So,
Any questions? Chairman Speakey, you're recognized.
Question on the bill.
Question has been called. So, Madam Clerk, if you'll open the board, please. Has everyone voted? We're waiting on Doc. All right. Every member's voted. Any member wish to change the vote? Madam Clerk, would you take the vote, please?
Mr. Chairman, you have 6 ayes and 0 nays.
All right. Representative Lynn, House Bill 1158 moves on to full insurance. Thank you.
thank you, sir.
All right. Now we are at item number 8, which is also Representative Lynn.
It is.
All right. You got second, thirds, and everything up here. All right. So
All right. Thank
do you have any amendments?
I do, sir. Amendment 5243.
Yes. Do I have a motion and a second on the amendment? All in favor of adding amendment 5243, say aye. Any opposed? All right. So you are now, the amendment is attached and you're recognized on the amended bill.
Thank you very much, Mr. Chairman. Last year, we passed a day for 2 conditions called PANS and PANDAS. And what is PANS and PANDAS? Well, it's pediatric autoimmune neuropsychiatric disorders that are associated with streptococcal infections. And these are not extremely well known. And in fact, there's not a lot of physicians who are currently treating this in Tennessee, but Tennessee has a very high prevalence of strep conditions among people. And I do think that this will start to be more recognized. It first presents to parents as sort of a psychiatric condition. Your child wakes up one day in the morning and they're just not themselves. And they start having effects at school, with their schoolwork, at home, disturbances, all of that. So it is a very serious condition that seems to present as a psychiatric condition, but actually it is a physical condition. And treatments are being developed and have been developed to help these children, recognizing it and informing, especially TennCare patients, that this condition is there and that TennCare will cover the condition. TennCare told us they do cover the condition. Very happy for that. However, it's not on the list currently at 715107 kinds of medical services. This bill will put that on the list, stating that TennCare will cover this if diagnosed by the medical provider. And families across Tennessee have struggled with delayed diagnosis because it's not very well known, and then also access to effective treatments, creating unnecessary financial and emotional burden for families. So ensuring this coverage and building awareness of this is extremely important in Tennessee. This bill ensures that TennCare and its MCOs provide coverage for physician-prescribed treatments for PANS and PANDAS. The treatments may include antibiotics, behavioral therapies, excuse me, I need to change this word too, as our previous representative said, immunomodulating medicines, plasma exchange, and intravenous immunoglobulin therapy. No child should be denied coverage or delayed in receiving treatment simply because they have received a prior care or because their condition was previously classified under a different name, such as autoimmune encephalopathy. This bill provides clear insurance protections so that families can access necessary care without unnecessary barriers. Following medical best practices, the bill aligns treatment coverage with recommendations developed by a professional medical consortium that researches, identifies, and publishes best practice standards for diagnosing and treating PANDAS and PANS. This ensures that decisions are based on medical evidence and positive patient outcomes rather than administrative restrictions. Until specific diagnostic codes are assigned by the American Medical Association and the Centers for Medicare and Medicaid Services, this bill ensures that PANDAS and PANS are coded here in Tennessee as autoimmune encephalitis for billing and diagnostic purposes. If new coding is introduced in the future, the law will automatically apply to those updates, ensuring continued coverage for the affected children. The bill takes effect immediately upon passage because families cannot afford to wait for coverage. Ensuring coverage for PANS and PANDAS treatments is a moral obligation, a healthcare necessity, and common sense. And as I stated, there's not a lot of awareness about PANS and PANDAS, so I love that it will be added to the list of kinds of medical services to create that awareness. Also, as physicians learn more about this and they can treat the child with these therapies that are really helpful, the antibiotics, the immunotherapies, rather than just, these psychiatric drugs, that is when children will make real progress to recovering. I have a mother here who has fought this battle. Christy, we did ask that she might be allowed to share some of her story and testify to this committee. She's an amazing woman and what she's been through. And listen, we're here for TennCare today. She's not on TennCare. She has private insurance, but her desire is to help people who don't have private insurance to learn more about this condition, to make sure it's covered and that their children get appropriate treatment.
Okay. Before we do that, Chairman Speakey, you're recognized.
Thank you, Mr. Chairman. Just to clarify on your amendment, you changed some language in your amendment from required to may require. What are we now not requiring TennCare to do?
So TennCare asked for that change because they do not have many items in code that say require. It says may require just in the event that perhaps there's some other diagnosis, there's some mistake, whatever. It's not tying TennCare's hands. We are allowing physicians to make the proper diagnosis, second review of the patient, whatever, allowing that to happen instead of tying TennCare's hands. And TennCare asked for that, and we completely understand what TennCare means by that. And like I said, there's not a lot of conditions that have that language require.
Chairman Spicky.
So with that amendment on here, does this give, because it says may, it doesn't say require anymore, and I'm looking at the bill summary, it talks about TennCare to require every group health insurance contract, every group hospital or medical expense insurance policy plan to cover pandas. If we're changing that language to may require, then can TennCare not do it? It sounds like, Mr. Chairman, it sounds like by changing the language, it's make a recommendation to TennCare to cover this, not requiring them to cover it. Am I reading that wrong?
Representative Lynn, you're recognized.
TennCare looked in their records and they have had patients diagnosed with PANS and PANDAS, and they have not denied service for any of those patients. So the fact that it says may require doesn't mean they would arbitrarily deny service for a diagnosed condition. It's just following suit with other conditions that are in law for TennCare.
Chairman Spicky.
So I'm in support of your bill. If this bill makes it out of this committee, can you get an answer for us in the full committee on whether or not this allows TennCare the ability to say, we're not going to cover this? Okay?
Yep.
That's all I need, Mr. Chairman. Thank you.
Let's do this. Let's go out of session. And we're going to ask legal, Chairman Sapiki, for a little clarification here.
Love and Middleton, Office of Legal Services. So the amendment does change it to may, so it is permissive. TennCare is permitted to require that, but they do not have to, no.
Chairman Spicky, do you have a question for legal while we're out of session?
That was my fear, Mr. Chairman. Thank you.
Representative Sparks, you've got a question for legal?
When you hear the acronym MCO, explain that. So I see here behavior, so it can be interpreted as health maintenance organization, behavioral health organization, or managed health insurance.
So that's how the term is defined for purposes of that section. So it does mean a health maintenance organization, behavioral health organization, or managed health insurance issuer that participates in the TennCare program. It's defined that way.
All right, thank you, ma'am.
Chairman Spicky.
This is for legal. MCO are the 3 MCOs that we deal with in the state of Tennessee that provide the health coverage for our TennCare patients. Is that correct?
I believe so, yes.
Thank you.
Any other questions for legal while we're out of session? All right. So we'll go back in session. Chairman Spicky, did you have a follow-up with the sponsor? Any other questions for the sponsor? Because my understanding, this is already covered by TennCare, correct?
I didn't know if it was on. TennCare does cover this. They have had physicians contact them with the diagnoses, and physicians have wanted to provide treatment, and TennCare has not turned them down. There were not specific medical codes for it, but TennCare has not turned them down.
And that was
is
what
my understanding.
That is what I understood, that they don't have an actual code for that. It's kind of like
Exactly.
we did a couple of weeks ago with the Cleefstra that Chair Lady Littleton did, that that was treated under other things. But now we've pulled that out and said this particular, and I think TennCare maybe had a code for it, but doesn't have a particular code for this particular for the pandas, but that it's already covered when medically necessary is what they told me earlier. So, okay, any other questions? All right, seeing none, then we're ready to vote. Madam Clerk, would you open the board, please? Members, if you'll vote. Has all members voted? Any member wish to change their vote? Madam Clerk, would you give us the vote, please?
Mr. Chairman, you have 7 ayes and 0 nays.
All right, Representative Lynn, House Bill 411 moves on to full insurance. Thank you.
Thank you, sir.
All right. Now we're at item number 9, which is House Bill 385 by Representative Butler. Have a motion? Have a motion and second. Do you have an amendment?
No, Mr. Chairman, I don't.
No amendment. All right. Representative, you're recognized on your bill on House Bill 385.
So it's interesting, the bills that were before this committee before I was up here looking to solve a problem, this bill will help potentially remediate some of the pain for our providers. So this legislation, and we're working with TennCare, and to give you a little bit of history with our federal representatives, we are awaiting a response on this legislation from the IRS. So what this legislation would do, since we have approximately 1.6 million TennCare patients, approximately 70,000 providers in the state, and I think it was mentioned before on another piece of legislation that the pay that providers are compensated on, 30, 40, 50%, we could argue what percentage of compensation they receive, but it's not comparable to, say, a private insurance. So some medical providers are unable or unwilling in some cases to provide services to our TennCare patients. So what this legislation would do would provide a charitable donation to the medical provider for the difference in 125% of Medicaid and the TennCare rate. So let's just say for a moment the Medicaid rate was $100 and the TennCare rate was $50. That would be $125 on the Medicaid rate, $50 on the TennCare rate. So the medical provider would receive the difference, which would be $75 in this instance, as a charitable donation on his or her federal taxes, which is the reason we're waiting on the IRS to bless this. Legal didn't have an answer whether we could do this or couldn't do it. It's a gray area in the tax code, federal tax code. And so the reason for moving this at this point is to not get, for the final calendar, not be able to move this into insurance full. So if we do not receive our letter from the IRS, yay or nay, or you can do it, but under these circumstances, this will not go any further than this committee. We will hold off until next year whenever we receive that. And then once we've gotten a blessing, I'm hoping, from the IRS, then we'll work with TennCare. I've met with TennCare. There are going to be some details that's got to be worked out in order to figure out how to make this work. But I think what it would do is if we could increase our TennCare primary care appointments by just 10%, we would actually save our hospitals money because, as it was already mentioned earlier, our emergency room services are some of the most expensive care we can provide. And so if we can create more opportunities, because all of the 50-something doctors that I've spoken with, they said they would take a few more TennCare patients because they would benefit financially. It would give them a write-off. They're not going to get rich because most medical providers, and I know Dr. Kumar's on this committee, are providing care to TennCare patients because they want to help serve their community and their constituents and so forth. And so with that, Mr. Chairman, without getting any more down in the weeds, I'll renew my motion and be glad to answer any questions.
Okay. Let me ask a couple of questions to you, and then I see that we have some others that are wanting to. So if the provider is under contract with TennCare, knowing that these are the reimbursement rates and stuff, so how do we, if they know that these are the rates they're going to be paid, how do we look at that and say, okay, that's charitable because I've agreed to the contract that I've made with TennCare? Are we getting into
So without getting too far down in the weeds with the way all of this is structured, and some of those rates are all negotiated. So there's going to have to be some type of just numbers or averages. And this is what we're working with TennCare on. And this is where some of the complexity comes into play, is trying to figure out, here's your Medicaid codes, and I'm going to simplify it. Here's your Medicaid codes. Here's the equivalent TennCare codes. the difference is this amount of money. That would be your charitable donation. Now, some of those MCOs had negotiated different rates with different providers. And so one might be $75, one might be $81, one might be $68. We're going to have to come up with some type of average. And so I will say working out some of those little intricate details is what we're going to have to do with TennCare. But really the first step, and I've been waiting on the IRS letter for months and months. It's been 6 or 7, 8 months now. So if we don't get it before session is over this year, I anticipate getting it in the summer or the fall. And then I would bring this back. And in the meanwhile, we'd be able to work with TennCare. But by some miracle, if we get something back from IRS in the next few weeks, I don't want to be not through subcommittee with the opportunity to work with TennCare and figure out, even if we had to push the implementation deadline down the road to give us time to work out some of those details.
So Representative Butler, and these are just some notes and thoughts as I've looked at this. So is there an average federal Medicaid rate across the board? Is there, I mean, if we're trying to come, is there something like that set that we would be able to look at?
Thank you, Mr. Chairman. I think we're going to have to establish average, because there again, those MCO rates are negotiated per provider. And that's some of the discussions that I've had with TennCare, is trying to figure out how we do this and not have, for lack of a better way to explain it, hundreds of thousands of different numbers. So my simplification of the process was, if we have a variation of $75 to $85, then we're going to use the average of those two. That's the amount we would use for Medicaid. Same thing. And so there possibly could be, if you had an MD, you had a nurse practitioner, you had a medical assistant, we may need to create some scales in there for different providers. But my objective would be to keep this simple, because if we can create 10% of additional appointments, we're going to reduce our hospital emergency room services. So you can go to your primary care physician. And I think it was mentioned earlier by one of my colleagues, is we can avoid some of these chronic treatments where somebody has avoided treatment long-term because they couldn't afford to get an appointment, or they couldn't get an appointment. And I'll tell you where this legislation kind of genesis of this, and I worked with TennCare, and they've done a fantastic job. I had a constituent looking for a dentist, and I said, well, there's 3 dentists in town, or maybe 5 dentists in town. Well, none of them took TennCare. Well, I didn't understand what TennCare paid, what they didn't pay. I didn't understand all that. And so as we looked into that, worked with TennCare, we did find the gentleman a dentist. But I realized that if we incentivized the doctors, so your alternative is raise the TennCare rates, which would be an exorbitant budget amendment, or we provide a charitable donation, which would cost the Tennessee taxpayers nothing. But we would also solve other problems in the same time by, one, keeping them out of the emergency room for that most expensive care, and giving them more primary care appointments. So that's kind of where we are now. How to get it to actually implemented, we'll have to work with TennCare, and that may take a little bit of time to figure out.
Okay. Final question from me, and then if the other members, I noticed here in the bill under the summary that the charitable contributions provided by the provider in a calendar year by January the 31st of the following year. Do you feel like, and I know like you're in business like myself, 1099s and W-2s and all of that, and by that January deadline, but yet with the way billings and stuff like that for the December services, are they going to be able to get that in and be able to turn that around in that 30-day? And a lot of that depends on the providers getting it, billed, and then all of those things. So
thank you, Mr. Chairman. That's a great question. And I spoke with TennCare yesterday. We had a good meeting yesterday, and we would be willing to move that deadline. That was just how it was originally drafted. Most likely that would probably be moved out into March sometime toward the end of that quarter. Obviously people would file their taxes in April. So we would need to have that issued before that to not hold up a provider from the ability to be able to file. But I think all that's flexible. We can work on those dates. It could be all March 31st. We could do it into February. We would want to work with what's a reasonable time for TennCare to get all that process, get those things issued. So that would be something we would probably need to work out in the details.
Okay. All right. Any other questions? Representative Sparks.
Speaking of the ERs being overcrowded, the Secretary of State and I were at Stonecrest and Smyrna a couple of years ago, and that was his biggest concern. He said, man, we've added 16 beds over here, and every one of them has been full. But this, you said you sent the letter back to the IRS when? Which month?
Thank you, Mr. Chairman.
Butler.
I believe it was September. We're working with our federal representative, so I didn't send him a letter personally, but Congressman did.
Well, you know there's a new sheriff in town, right? Did you know that?
Well, Mr. Chairman,
Representative Butler.
if I can, we don't currently have an IRS director. And so most likely we will not get this letter until that IRS director has been named. And I've been told that it's kind of a low hanging fruit priority. They're getting to it.
Yeah.
So by some miracle, we might get this in the next 2 weeks. If
Well,
not, we'll continue to work through the summer and for next session to have this ready.
Representative
Well,
Sparks.
Representative Butler, what I like about what you're doing is you're getting creative, and this kind of came from a constituent, didn't it?
Representative
Thank
Butler.
you, Mr. Chairman. It did. You came trying to find a constituent, a dentist, and that's
Yeah.
kind of where I got the idea. Well, why don't we help provide
It
some
didn't come
alternative?
from a lobbyist.
No.
Didn't come from a big corporate donor. Came from really came from your heart because you cared about that constituent. So what I like about this, you're kind of getting creative, and we got to get creative because I worry, Social Security's going to run out, 8 years? I'm getting a little older. So, hey, where we going to be? You know what I mean? So, we're doing more with less. That's kind of what you're advocating for. So anyways, hats off to you, and I'm going to support your legislation.
Thank you. Any other comments?
Thank you, Mr. Chairman. I renew my motion.
Anyone? Any other questions? Chairman Speaky, do you have a question?
I'll move previous question if I can.
Yes, sir. All right. Question has been called. So, Madam Clerk, if you will open the board, please, we will vote. Madam Clerk, will you take the vote, please?
Mr. Chairman, you have 7 ayes and 0 nays.
All right. Representative Butler, House Bill 385 moves on to full insurance.
Thank you, Chairman and committee.
Okay, we've got a little housekeeping, and then I'll pass the gavel to Chairman Kumar. I have the last bill today. House Bill 1101, which is item number 10 by Representative Salinas, has been rolled to the first calendar of 2026. House Bill 1104, item number 11 by Salinas, has been rolled to the first calendar of 2026. And item number 12, House Bill 1393, has been taken off notice. We'll shift gears here and pass that to Chairman Kumar.
Thank you, Mr. Chairman. Item 13 on the calendar is House Bill 711 by Chairman Hale. We have a motion and a second. Chairman Hale, you're recognized on this. I see an amendment.
Yes, Amendment 5319.
Can we have a motion to attach the amendment to the bill? Have a second? I'll second that. Everybody else is on a slow response gear. Okay. So we have a motion and second to attach Amendment 5319 to House Bill 0711. All those in favor, please say aye.
Aye.
Opposed? The amendment goes on the bill. Chairman Hale, kindly explain the amended bill to us.
House Bill 711 was brought to me by the Tennessee Disability Coalition with the support of the disability community. The intended purpose of the bill is to request that TennCare collect and publish additional data about its medical provider network adequacy, specifically limited to services meant for Tennesseans with disabilities. Currently, TennCare collects and publishes data on its network adequacy using federally mandated time and distance standard, as well as a number of other federally mandated standards. This bill does not change that. It adds 3 data points to that reporting with the purpose of identifying types of care and services that are difficult to access for TennCare members, as well as areas of the state where providers are difficult to find. Those additional data points are the average percent service utilization, or how much of a service are TennCare members actually receiving versus the amount of services which they have been allocated for their in-person centered plan. The average appointment wait time, and then thirdly is the average time between approval for a service and then the start of the service. This bill also asks that TennCare have this data on a county-by-county basis by service or care type by waiver program. This would, in the future, allow the data would allow TennCare in the state to address any potential issues with the provider network at a granular level with highly targeted and highly efficient solutions and investments. So, Chairman, with that, renew my motion.
Thank you, Chairman Hale. You are addressing a very important issue in TennCare's ability to provide adequate care and coverage for its recipients. It is a challenge for TennCare to maintain a satisfactory network of providers and adequate network of providers that are located within a reachable distance for the recipients, because again, reimbursement is low. And as a result, many physicians either may not want to participate in the program or restrict the number of patients they see on a regular basis. And as a practicing physician, I confronted that all the time. And yes, when physicians get busy, as I did very much during my peak years in practice, the temptation is to take less TennCare patients and more private pay patients. And there were many discussions around our kitchen table when I'm late and tired and so on. And the tendency was to do what I already said. Yet, my feeling at that time was that we are raising a child and teaching her to be giving and volunteer and have a spirit of charity. And you can do that if you're having this discussion and the child is listening. So I think you have to step away from selfishness, and there is a missionary part to taking TennCare and working with TennCare. And I think we are blessed to have that. So I never did stop taking TennCare and never restrict the number of patients that we were treating. But the temptation is there, and it's a natural human nature that happens. So TennCare struggles with that, but yet they have an obligation, and we have, as legislators, have an obligation that adequate TennCare network is available to our constituents and recipients. With that, I compliment you for bringing this matter up, and I think TennCare will respond to that as long as we are with them. I have Chairman Speaker, you're recognized.
Previous question.
Without objection. Okay, so Chairman Speaker is withdrawing his motion, and Chairman Sparks, you're recognized.
Yeah, thank you, Chairman. I just wanted to ask on the fiscal, this from my own education, this is for staffers, I guess, when you have this, what,
They're
1.6?
saying, I'm sorry, I recognized.
Yes, kindly ask your question again.
Well, the fiscal note, I'm assuming that's staff. Right.
From what I understand, Representative, is the cost is implementing maybe some new systems to be able to generate the reports that's been asked for.
All right, thank you.
Chairman Sparks? All right, okay. Chairman Speaker?
Move to his question.
All right. Previous question is called without objection. We are voting on House Bill 0711 to move to the Insurance Full Committee. All those in favor, please say aye. Oh. By electronic voting. Madam Clerk, kindly count the green numbers.
Mr. Chairman, you have 7 ayes and 0 nays.
The House Bill 0711 moves on to full insurance committee. Thank you.
All right, members, this concludes our final calendar. At this time, I want to thank all of you, the members of this committee, for an incredible year, for your dedicated service to this committee. Thank you to our research analysts, to our attorneys, clerk, sergeant at arms, intern, everyone that's made this committee so great. Ryan, Lovin, Middleton Dunn, Matt King, Hannah, Chelsea, Ruben. All of you have made it great along with these members. So at this time, are there any other personal orders? Representative Love.
Thank you, Mr. Chairman. This is my first time serving on the TennCare Subcommittee. I want to thank you for your leadership. Thank you for the robust discussions we've had. And again, congratulate you on chairing this wonderful subcommittee this year.
Thank you, sir. Mr. Parkinson.
Thank you, Mr. Chair. I just want to tell you, great job on your rookie year.
Thank you.
You handled it like a champ, and I've enjoyed serving with you. You've been awesome. Appreciate you, and the rest of the committee also, and the staff and team. Thank you.
Thank you. Representative Sparks.
I just wanted to say, I want to brag on the chairman. You know, I hope it's okay if I share this story. I was getting out of my vehicle last week. He pulls up. Remember, he's in a wheelchair, and he beat me inside here. He beat me in here. So he was like, what is it, man? You're speeding through here. But anyways, great job, and thank you, staff, for all you do.
Thank you. Thank you. All right. So at this time, we will adjourn subject to the call of the chair.